Okay. Can you guys see our case study here?
Yep.
Okay, so what we're going to do tonight is kind of start to talk through how you will go about uh, this kind of a situation when you come across your horses or your client horses. Um, we collect our basic information, and so some information is kind of changed just because this is a true case study. Just some information has changed in case this gets shared out. Um, but for giggles, we're going to call the horse Apollo. He does eventing. His health history, we can read through that. The suspensory ligament strain. And do you guys know the difference between a strain and a sprain? So a strain is what most people call a sprain. Um, a strain is like you pulled a muscle, you hyperextended it, or something like that. A sprain is a tear, always. So a sprain is a tear in a tendon, ligament, or muscle. So a strain means that it has been overstressed and is fragile, it's weak, there's damage to it, but there's not a tear in there. Um, most of us have had a strain at least sometime in our life, especially if you work around horses. But it doesn't mean you've ever had a true sprain. Anybody in here ever had a sprained wrist or a sprained ankle where you were in a boot for a while? Something like that?
Yeah.
So a strain usually takes a couple, maybe a week or two to overcome and heal, while a sprain can take anywhere from a few weeks to several months to heal, depending on what it's located in. If it's in a ligament or a tendon, that takes a little bit longer. If it's in the muscle belly, speaking from recent experience, I just tore my calf muscle like 3 weeks ago, and it's still very sore, but it is healing and I can walk on it. Um, so muscle that, and in all fairness, I did lay on PMF every day. So I might have helped it heal a little bit faster than it would have by itself. But so this horse had a suspensory ligament strain in the right forelimb a couple of years ago, and it got fine after some rest and slow rehab back. Hock arthritis 6 months ago. It's actually bilateral. So there's additional notes that should be in here. So what I would do is I'm going to add in what questions we want to ask. So hopefully this will be helpful. What questions would you want to know about the suspensory?
I'd want to know what the rehab process and protocols were that the vet or whoever
Okay.
performed on them.
And what will that information tell you?
I'd also want to know when its last ultrasound was of that area.
And is it, so the suspensory branch is there, right, in the front? Is
There's
it
a
medial
suspensory
or
branch in
lateral?
all four legs.
So is it medial or lateral or
So
further?
where, that's a great question. Where on the suspensory branch was it? Do you know why we should need to know that? Why do we need to know that? Why do we need to know those three questions? And any other questions we want to add to this?
It might help us find information on any other areas that might be complicating for like based on where it was, but also like if there was any other things behaviorally that could have potentially came from the rehab process of it,
Okay.
or changes to the horse's body overall just from the whole process.
Yep. Anything else that you guys would want to know as it relates to the suspensory strain?
I would want to know if they knew when it happened or what the horse was doing when it became lame.
What would that tell us?
what the horse was compensating, like if they were jumping, they were landing heavier on their forehand, or were they jumping in deep mud, or were they, galloping, like depending on what the horse was
Prevented,
doing.
right?
Yeah, yeah.
And also, if you knew what happened and how, then you could prevent it from possibly happening again, if possible.
Possibly. I mean, if it's from jumping, then, there might have to be some adjustments made at least temporarily, to prevent further strain, or possibly, the training on how the horse is jumping needs to be addressed. So that's an excellent question. Is there anything else that we would want to know as it relates to the suspensory?
This
Are there any
horse-
other areas affected?
Like any other from the strain, like were there any other tears or strains?
Mhm.
That would be in the notes. So not in this case. So usually if there's something additional, that would be highlighted in the vet notes. So we don't have that information.
Oh, okay.
This might pertain to the rehab protocols, but I think I'd also want to know what they do maintenance wise. Like, okay, after you jump, do you ice? After you do you add supplement, anything like that? I want to know what they do for maintenance.
Okay, so let's do this. I'm going to change that. Or how about, should we say, is there any, how about medications, veterinary recommendations? Anything else you guys would want to know here?
I mean, I would want to know how bad the strain was, and like, were the fibers actually damaged? Were they not damaged? Like, what was the extent of the actual injury?
So the nice thing about it being a strain is that usually the fiber, there's no tearing in the fibers. They've been strained. I wish I could come up with a better word for that. But there's usually no tearing, but we still need to know the severity. There's one other question that I would love to see if somebody can come up with.
How long did it take the horse to get back to 100%?
That's a good one. One more there. And this is one you guys might not think of, but I'm gonna challenge you to see if you can come up with it. Oh, let me know when you're ready and I'll tell you.
How long was the horse? How long did the horse have the strain before it was actually identified?
I think we
By
asked
the
that
vet?
already.
Okay.
Do we know when it happened or what the horse was
Oh.
doing when it happened? So we either know or we don't, right?
Right. Uh-huh.
The question that I would ask is, was the other front limb ultrasounded for comparison? Did they check that? And the reason why I would ask that question is because when we're talking about a strain or a sprain, specifically in a suspensory, the one that got damaged is almost always on the side that was compensating for a weakness on the opposite side. So I would want to know, was there are there micro tears in the ligament on the other side? Is there fraying going on where this horse may have been loading unevenly up front that caused that one to lose some of its integrity? Most of your clients are not going to pay to have both legs ultrasounded. I will always do that going forward because I missed this on one of my own horses once. And it caused not just the strain, but I ended up with a tear. So,
I have a question. Is that something that you would ask the vet to do? Or should
I
the
did.
vet
Well, my
suggest
vet
that?
was the one who suggested it. For those of you who are up in Wisconsin, that was Dr. Horner who suggested it. And we found that like after the fact. Once we knew it was a suspensory tear from CSU, I consulted with her and she was like, they need to look at both hind legs. And the left hind was compromised enough to overstrain the right. And so him, even though it was imperceptible, overall it was really hard to figure it out. He was compensating. It just wasn't obvious.
Okay. That's good to know.
There you go. Anything else you think that we should add to that? So let's go on to the hocks and then we'll go through like what we would do in this case. So with the hocks, anything that you would ask on this? I have lots of questions on this one that I would want to know.
How often is the horse having a joint injection done?
Yep.
And adequate too, like how are you doing the recommended amount?
Is it in both hocks?
Yep. So how often is the horse having joints and what compound is used? And we want to know what compound is used because if they're using a steroid and they're doing it every 6 months, that cartilage is breaking down, period. You can get about 6 joint injections with a steroid in the compound before the cartilage starts to break down. That's it, just 6. What was the other question there that you guys mentioned?
Has
Is it
it
in both hocks?
Okay.
additional imaging or any other things that have been done?
Yeah, how was it diagnosed?
And since they've started the joint injections and Adequan, has additional imaging been done on those areas, but also in other areas of the body that might be showing compensation patterns?
Yep.
Can you scroll your screen down a little bit, please?
Oh, yep.
So I don't know much about hock joint injections.
Mm-hmm.
So when you're talking about the hock, the joint itself, right?
Yes.
And where do they inject that into in the
So there's an upper and a lower joint, and depending
Right.
on how they do their diagnostics, they could go on the upper and lower on the medial side or the lateral side of the joint. It just, how they determine it, I don't know. That's for the vets. I really don't know. I should ask that question, but I don't know. But there's an upper and lower joint in the hock, and they will often inject both.
Okay.
So, any other questions that you guys would ask on the hocks?
How severe is the arthritis? Where is it at on the scale of 0 to 10 or?
I'd be
I'd
curious
say-
what the joint fluid looked like.
That's a great question.
The joint foot, yeah.
Does everybody know what it should look like?
Should be clear, right?
No.
No? Oh, okay. Then no, I don't.
If it's clear and watery, it's full of inflammation. If it's more
okay.
like cloudy and viscous, like slippery in your fingers, that is healthy synovial fluid.
Synovial fluid. Okay.
Yeah. So the fluid inside the joint is called synovial fluid, assuming that we are in a synovial joint. Not all joints are synovial joints, if you remember in your anatomy, if you've gotten through that yet. And so that synovial fluid should look a little bit yellow and a little bit cloudy, and it should be really slippery to your fingers. If it's watery, it's going to feel a little bit more sticky and clear. And it's literally going to kind of feel like water with the residue. You won't feel the stickiness until it dries. I think that we covered all of this. Like, how was it diagnosed? If it was just diagnosed with flexion tests and they didn't do imaging and the hock is sore, how do we know that it's arthritic? And full disclosure from the vets, they will make that assumption without doing any imaging. And here's why we need to understand between the suspensory and this is because our vets go in for the purpose of diagnosing, and if the horse tests positive in a flexion test, but there's no imaging, all we know is that there is strain on the joint and that the joint is uncomfortable. But
and when they're flexing the hock, they're flexing the stifle. So
yes,
you need imaging to differentiate which one it actually is.
exactly my point. And then you also, we can't make assumptions. And here's what I have worked with vets over the last, 13 years. When a horse is sore in the hocks or stifles and there's no imaging done and they just go right in to help, like to do an injection, and then they're doing maintenance injections. Remember, we have all of this soft tissue that crosses the joint, and all of that is activating the joint. We can reduce, and I mean this sincerely, even though we can't legally claim this. Like, I wouldn't go out and put this on Facebook, okay? Like, don't market yourself this way, but know that you can help your clients reduce the frequency of injections by working all the soft tissue that supports and crosses the joints. And if there is no actual arthritic changes, you can use an injection to help break the pain cycle and then work through the soft tissue to help prevent the need to continue with injections for pain management. If there's no arthritis in there, we should not be needing to do that. We should be looking and going, why is the hock continuing to get sore? Where is that coming from? Is it an imbalance in the feet, or is it a conformational thing? Is something else going wrong further up in the body before we just throw an injection into it? Here's why we throw injections in the way we do is we have our own personal goals. It's time consuming and very expensive to figure out causation. And most of us have goals for showing. And as long as our horse is comfortable and happy and healthy and willing, we do the minimum that we need to do because they're so dang expensive. And so also, if it's a top performer, one thing that's really nice about some of the injections that they're doing in the joints right now is they have compounds that do not include steroids. They include a lubricant. They might include chondroitin and glucosamine to help calm the inflammation down. But there are compound options that don't have steroids anymore. And then inject those all you want. Like, I mean, that doesn't hurt anything. It's not going to break the tissue down. But steroids will. And so we can educate our clients and say, look, this is what occurs. Feel free to chat with your vet about it. But like, steroids do break down cartilage. It breaks down the integrity of a joint over time. So it's like Botox. You do it initially, it looks great. You keep doing it, you start to look like it, things. I won't say in case anybody on here does Botox, but any other questions we would want to know in regards to this part of the health history? I don't have anything I would add here. Okay, so we'll move on. So the chief complaint is the performance in dressage is declining. The horse is not collecting or engaging its hindquarters. Stiffness, doing lateral movements, and they notice mild lameness intermittently in the trot after they have a heavy workout, hard rides. Behavioral signs: the horse is pinning his ears when he gets tacked up. And I should say switching. Let me change that, not swishing. There is a difference between swishing of the tail and switching of the tail. A swish of the tail is a gentle kind of like movement back and forth. A switch is when they get you between your sunglasses and make that one hair go right into your eyeball. If you ever watch equine behavior, when a horse switches its tail, it is a warning. Something is uncomfortable, something hurts, they're pissed, or they're defensive, or all of the above. But tail switching is a sign of something is not right. And it might be that there's a fly on and they're annoyed, but a tail switch is a strong communication of, I don't like that, whatever it is. I don't like it, it's uncomfortable, etc. And so when they go over the lumbar, the horse tail switches when they're grooming it, and then a bit of a reduced appetite in the previous 2 weeks. The vet notes, here's our answer to that upper question. Radiographs confirm mild arthritis in both hocks, so it's mild. The ultrasound shows no current suspensory injury, and there's no fever, and vital signs are normal during checkups with the vet. The rider stating that they feel uneven under saddle, especially on small circles, doesn't push well off during the jumping phases. And the farrier finds uneven wear on the hind shoes, suggesting uneven weight distribution. But look at that next sentence. No hoof balance is noted. His answer right here says that there are hoof imbalances. It's a complete contradiction. You can't have uneven wear and then say that that there's no hoof imbalance. The imbalance might not be coming from the hooves, but the hooves are affected and the balance is affected. If it wasn't, there would be no uneven wear. Uneven weight distribution is a sign of imbalance. Do you guys agree? So that's a little bit of, a contraindication there, or a contradictory statement. Is there anything else that you would ask the client regarding the complaints, the behavioral signs, the vet notes, or the rider feedback, any of this section, the rider feedback, etc.? Anything else that you would ask there or want to know?
I'd want to know.
They've had,
Sorry,
Oh.
go ahead, Brandy.
I was gonna say if they've tested for ulcers.
Dang it, Brandy, that was what I was gonna say.
I figured I was gonna try to beat you.
Also wonder how the saddle fits.
I'd also wonder too if they're having additional things done like chiropractic, if like the sternum's a constant issue, or like if anything else like that is kind of a reoccurring thing.
There we go. Okay. Horse, whoops. Saddle fit. That was what I was going to ask. Okay. Okay, what was the other one? I'm sorry, I got behind there.
Ulcers was one from Brandy.
Yeah, we got that one.
And then the other one that I said is if there's other modalities being done like chiropractic, if there's reoccurring issues or anything skeletally. And I'd ask if there was videos of any of this. Like I'm not going to ask a client to ride their horse hard simply so I could see a lameness video.
Okay, and we'll put that question up here.
When it says
Oh.
reduced appetite for grain, is the horse eating hay fine? Is the
That's
horse
good.
drinking
I was wondering if
okay?
anybody would ask that
Like,
question. Let me add that
what-
in before I forget.
With that as well, I'd want to know of any like weather changes. Obviously, I don't know where this horse is located, but it could affect that as well.
And our
I'm gonna
new
add
supplements
this.
supplements added, like they said they were on a joint supplement. Is that new? Is the horse not liking that?
When was the last time their teeth were looked
Teeth.
at?
Yes.
Yeah. All the things.
Yeah, all the things. But this is why we're doing this, because like, do you see how many things that we can dive into? And I mean, if you're thorough, I'll just add this. I don't know why my question, this is the weirdest thing lately. It's changing the format. I'll fix it later.
Could you ask what the farrier schedule is and if it's been consistent as well too? Or any like differences with shoeing or whatever?
Are there any pads or anything?
So we want to know the frequency, type of shoes if shod. Wedges, etc. Anything.
And
Yeah.
even honestly, going back to like the suspensory injury, like did the horse have big studs in when it got hurt? Because like that makes a big difference. If you put too big of studs in, that's gonna hurt your suspensory for sure. Sorry.
Agree.
Yeah. People oversteered way too much.
Oh, for sure. Been there. Not me, but I had to put them in and I was like, ugh.
That's really big.
It just rained a little bit. Anyways.
Well, just a really funny, because I sent this to a couple people. I did not get a picture yet, but I was clipping Simon. I was actually fixing, I did an Irish clip on him the other day and I kind of messed it up because he was wiggly. And I went to do it again and fix it. And this horse, he spooked. So he has a stripe on his head that looks like the bear from the Great Outdoors. He looks so stupid.
Poor Simon.
Been there. Been there. Yeah.
He's so stupid. It's like going down the side of his neck, like it was supposed to just make that nice line by his pole, and I was trying to make it nice, and he flinched, and so it went. Sorry, I digress. Okay, anything else that we want to know about these things up top?
Have there been any back x-rays with the lower lumbar or anything looked at there? Because it says on the veterinarian, or not, sorry, the behavioral signs, like that it's over the lumbar region.
Yeah.
I'd also be curious, like how his neck palpates. Like, is his neck sore, and then he's overcompensating behind, or
Yep. So, anything else we want to write down on this that we might consider?
I'd also want to know if there's been any tack changes. I know we talked about saddle fit, but like, has anything been added recently within the last 2
Where
or 3
was our
weeks?
tacking up? Oh, here we go. Even boots, like they could change boots. So this is going to sound really funny, but Simon would get very upset if I used a specific saddle pad on him. Every time I walked up with that saddle pad, he would pin his ears. So now we're down to 2 that he's okay with. Every other saddle pad, he pins his ears.
I mean, I have horses like that with even grooming brushes.
Yeah, some of them just don't like it. They're
Don't like
hypersensitive.
it. Yep.
Um,
I have a sort of a question that I don't know as body workers if we're allowed to sort of ask this, but like on the bit situation, like sometimes people overbit their horse so much that the horse is super curled behind and they're not using their body correctly at all. And then they're on their forehand and they're like behind the vertical and then they're overcompensating behind and they're going to make themselves sore because their hind end's way out behind them. But like, how as a body worker can we even be like, hey, what kind of bit do you use? That's probably super inappropriate and making your horse sore.
so Daryl, that would be within your scope of practice. It would not be within mine because I am not a trainer. So I can't comment on what I'm seeing with a horse riding, but I can gently make suggestions. For example, like observations. When I had Sid, the first month I had him, when I was actually before he got hurt, every time I would ask for contact, I would go to establish contact. He would pop his head in the air. Once contact was established, he was like on the bit and fine. But every time I picked up the reins and asked for that contact, his head went up. So it took me working with a bit fitter to figure out that the bit was causing pain in the roof of his mouth and on his tongue. It was just not a good fit for him. And he was evading that pressure. And once the pressure was constant, he was fine, but he didn't like the feel of that being established. He went into a nave and it never happened again, like ever. So, asking a lot of questions about your rider. And so like Daryl, you would be able to say like, hey, you know, as a rider, you're really heavy in your hands. You're pulling this horse's head and neck back. If the horse is doing it without that contact, I would absolutely be going, is this horse overbitted? And I would make the suggestion for them to talk with their trainer and their tack fitter, whoever they use, if they do bit and bridle fitting, to make sure that those fit appropriately and it's not too harsh or too much on the horse's mouth. So we can make those suggestions, but I think in this group, especially on the group tonight, Daryl, you're probably the only one who has that in their scope to say, you know what, I see this a lot, you know, your horse is overbitted. Have you considered trying something with less bite to it? And probably what you're going to hear is somebody get defensive. And you can just say, just a suggestion, you can give it a try or not. That comes up sometimes. And I have done that. Like I have a client whose horse is a head shaker, and when they described everything, the very first thing that I asked them was, can I see how your bridle fits? And they put the bridle on and the head stall is so tight. It was pushing the ears forward and putting pressure on all the cranial nerves. They changed that. We've done 4 cranial sacral sessions and the horse doesn't head shake anymore. Like, that's a great question.
And I think people often want to have a sense of control, and like in dressage, they don't go to double bridles too soon. And in cross country, people don't like you're galloping, like you're going to go faster. And so people don't like feeling out of control. So they like bit up so they feel like they have control, but then it makes the horse work super incorrectly. And then you get all kinds of body issues because of that.
I have to find this article for you guys. It's an article. So it's, a group of case studies, and they actually found that there is a lot less pressure, or that's not the right word. The pressure in the mouth is more evenly distributed in a double bridle than a single. I thought that was pretty fascinating.
I think I
If
sent
it's
that to you,
used-
Chris,
if-
so I can
If
find
it's
it and
used
put it in the
correctly.
group.
Okay, sorry. What was that?
I think
Well,
I
I said
sent
if
that
it-
to you.
Oh, I
That
think you did.
article.
You might have sent that to me, but then I
Yeah.
saw it elsewhere too. And Daryl, what were you going to say?
I said if it's used correctly.
Yeah,
But
right.
if people just hold the curb rein, then it's not going to do anything, which is what
That-
most people that shouldn't be using one do.
Correct. So it all kind of, there is the variable of the rider's hands, right? And the
Okay.
rider using it. Anything else we want to chat about on this? before we go down? Okay. So when we look at what their current care looks like, they're using, and we don't know, like it says joint supplements, high quality. What questions would you, and what do you need to know versus what do you want to know? Everything we did up there is, in my opinion, a need to know.
I know personally when it comes to nutrition, that's out of my scope.
Okay.
So yeah, it'd be nice to know, okay, what kind of joint supplement are you using? Are you using Cosequin or are you using something else? But overall, when it comes to grain, that might be something I'd want to pass off to someone that has a little bit more knowledge about that.
Yep. So we could say on this, we could recommend, so we could recommend a nutritional eval, right? If it was warranted. Is there anything you would want to know about the nutrition?
Well, going back to that one question, one suggestion, have you been tested for ulcers?
Yep,
Maybe this would come into play.
absolutely. What would be questions you might ask related to nutrition to determine whether you would feel the need to refer the horse back for further diagnostics? Candace, I see your wheels turning, so.
I'd be curious how big the grain meal is.
Mhm. Is it a
And
new, sorry.
And how often the horse has hay, like all the time or only at certain times?
I'd inquire about poops too.
Okay,
If they have watery
like what is,
the consistency, or are they hard or well formed, or are they like super watery?
and so then you're looking at things like fecal water syndrome or dehydration. My own horse, for example, I watched him poop today and was like, nope, don't like that. And went and bought a couple bags of Replenimash because it's getting that time of year, and should have bought him 2 weeks ago. And he is crabby because he's a little dehydrated. And I wouldn't have known that if I hadn't looked at his feces and knew that it was time to start adding back the electrolytes and hydration.
Or is he
Anything
in
else?
a high stress situation, like constantly? Maybe this horse doesn't like to be trailered and constantly trailered or stressed or
So those would go under the behavioral stuff, and none of it was
behavioral.
mentioned. So we'll
Okay.
and here's the thing, like we want to ask a lot of questions, but we also don't want to, what's the word I'm looking for? We don't want to provide speculation to cause worry.
Okay.
So,
Maybe overwhelm the client.
exactly. And so if you start going, well, does your horse not like to trailer? They're going to start panicking about their trailer situation. And give them more anxiety when the focus is on the conditions and the chief complaints that they've provided for today. But these are things that we need to know related to what's going on, so we don't have to go fishing for more problems, I guess is what I'm saying. If they have more, they'll tell you. But we need more information to know what to do with what we're looking at. Anything that you would ask about the exercise program?
Chris, I actually have a question. Sorry.
Sure.
When it comes to feeding, I've seen a lot of like back and forth with using like hay nets
Mm-hmm.
or feeding on the ground.
Yep.
Is that like, I guess I would love to know your opinion on that. And like, is that a question you would ask when it comes?
I would, and probably ask that in this case as well, which I would get down under the assessment part. But horses were never meant to eat. I mean, like you don't see a horse like a giraffe trying to eat out of a tree.
Mhm.
So biomechanically, they are built to eat from the ground.
Okay.
That would be my preference, to keep things as natural as possible. Actually, Dr. Michelle DeBoer from University of Wisconsin at River Falls did a very lengthy study on hay nets. And what they found, and this has been published in PubMed and on the Journal of Equine Veterinary Science, and what they found was that feeding from horse nets caused very uneven tooth wear, which affected how the hyoid apparatus was working, and then therefore affected the shoulders, and so on down the chain. They felt that it helped slow the consumption of hay. But our feeding system for hay is, we don't typically, horses are not grazing for hay and forage much anymore. If you live in areas where you have great grass, they're grazing on grass, but like here in Colorado, we don't have any grass. So horses are fed hay. And guess what? It's stuck in one giant pile and they all stand there. So there's no foraging, there's no hunting for it. When I was a kid, we threw hay in the pastures twice a day, and it was fed in like a track system. They had to go find the piles throughout the day, and it kept them moving. And they also didn't eat all of the hay in one sitting and then go hungry or build up too much stomach acid. So the preference on that would be, if you need to feed from hay nets, they make these ones now that kind of hang really low, but if a horse has shoes, you can't have them up with it because they can get a shoe caught in it. Hay nets I like hay nets. Like, it's so convenient. It's easy. It's clean. It keeps my horse from eating all the hay in 10 minutes. But it definitely has its downsides too. If that answers your question.
It does. Thank you. I appreciate it.
You're welcome. Any other questions on the nutrition side? Okay, how about on the exercise plan?
It says light to moderate, but like how long are they riding each day and what are they doing? How often are they jumping? Like,
Yep.
if you're jumping a ton, that's not great. So
What
And,
kind
like,
of
how
ground
fit-
they're sorry, Daryl, go ahead.
I was just saying, how fit is the horse? Like that's important to know. Like, how is it fit enough to be doing what it's doing?
Yeah. Yeah, like what is it doing?
Okay. What kind of ground are they working on?
So that just says avoids intense work on hard surfaces, but we don't know. So
I thought up above they said something about intense workouts. So why is it now light to moderate? Didn't it say something about being lame?
Yep. After intense workouts.
Yeah. So I would love to know their definition.
Where did that go?
Guess kind of go
mild lameness noticed intermittently in the trot after hard rides.
Okay, perfect.
Yep.
Okay.
And so that is a great question, because that's the current complaint.
Yeah.
And so if they're telling you here that they're doing light to moderate riding, then what's your question?
I think I would love to know what their definition of a hard ride is. Because mine might be different than Brandy's or Candace's or Daryl's or yours. So I guess kind of gauging exactly what that would be.
That's an excellent question.
Is this an appropriate time to ask, like, what does their turnout look like? If they're stalled often, if they're trailering a lot to lessons, changing surfaces a lot within a week? Like, is that where you would ask
Yeah,
this?
we'll put that down under the hard surface question. Okay. Okay, what was the other part of that, Candace?
I had asked about like the trailering,
Yep.
because if we're trailering a lot of farther distances, that's wear and tear as well.
Okay. And anything else we want to add under exercise? I'm sorry, I'm itchy. I think that's pretty good, right? So on to body work. You know, we asked the question up, does does not, so we're answering some questions as we get further down. That is totally okay. The whole point of this is to get your wheels turning and that thought process going. So the course currently receives a massage once a month. They do not currently receive any equipment-based therapies, and they get a chiropractic adjustment every 3 months. What else would you ask here? Candace is like, good. Yeah.
I've been waiting. What what are the protocols or things that the equine massage therapist is doing? What is the same for the chiropractic? Do they have any soap notes that you could see? Um, does it feel like it's a reoccurring way in which they're doing it? Are they looking at other parts of the body? Because right now I'm just wondering about the head so much. I
Yep.
have so many questions there.
Okay.
I'm gonna stop talking and let other people talk, but if they don't, I have more.
Sorry, I just start typing my questions because it's automatic. I didn't mean to do that. I was like, wait, no, this isn't for me. Okay, and then let's say review. Okay. Okay. What else would we ask?
It says currently receive any equipment. Have they ever in the past?
Okay. All right, what else have you guys got? Did I lose Brandy?
No, I'm here.
Oh, I was like, okay, there you are. My screen just shifted. Anything else we want to ask here? I think those are good questions. I wouldn't have too many more to add to that. There's one more under the massage part that I would ask. If anyone cares to venture a guess.
Would you ask what kind of technique?
I would ask, so that would go under the protocols.
Oh, okay.
But what I would ask is, are there any particular areas the horse appears very reactive in when the horse is getting massage? Those would be my main ones. How you guys doing? I know it's almost 6. Are you guys cool to keep going, or do we want to continue this on Saturday morning? Keep going?
I'm good.
All right, if everybody's good, let's keep going.
Keep going.
Okay. All right, so the discussion points. Knowing what we know with what we've just dissected, and we have a lot of questions, but in the picture, like, we could look at the picture if you guys want. I can pull the picture up. But considering all of this other information, right? The suspensory and everything, when we start to think about assessment, what are some of the things that we want to be looking for right out of the gates? Okay, I'm going to get you guys started. The assessment, and this is what's going to be kind of funny, the assessment's not going to change. It's going to be the same regardless of what's going on with the horse, so that you're thorough. However, go, Candace. Well, you were ready. I just was interrupting you.
So it would be looking at any imbalances or like leg length disparities, things like that you can like visually see, as far as like if there's a hoof turned out, or
Posture.
what posture they're just definitely like how they're withers, everything. Like I'm wanting to say, like, look at the thoracic sling, look at the head, like look at all the areas that would cause compensation from an injury like this.
Okay. And what would those areas look like? And we'll make a little note under here.
One shoulder could be higher than the other.
Yep. So we're looking at the wither height.
Dip in front of the wither.
Yeah.
Compensation, like in the SI area, like if they have a like bump, like I'm losing my words, like a hunter.
So if they're getting a little bit hunter bump and a little bit congested through the lumbar.
Or like if their pelvis is rotated abnormally too, higher or lower, potentially.
Their elbows are in or out, or how close they are to their body.
Okay, what was that, Daryl?
Their elbows, if they're like sort of squishing them in, pointing them out, or how far away from their body they are.
Okay, anything else?
It's just whether they're parked under or if they're standing evenly on their 4 feet.
Yep, so let's add that. Under or out. Okay. What else should we be looking at for the physical assessment?
Range of motion.
Constant shifting.
So you're
Like if
paying
they're constantly
attention to, okay, shifting weight. And what was it somebody else said, Brandy?
Range of motion.
Yep. And what range of motion are we looking for? Where?
In the neck and head?
I'd be looking in everywhere.
Oh,
Yeah.
okay, yeah.
That
I
sounds,
feel like this is a trick question.
it was a little bit. Because we're looking at range of motion throughout the body, because if the suspensory has been affected and the hocks are arthritic, there is hind end compensation, which means that the front end is doing more work. And one of the two hinds is probably affected. And so I'm going to scroll up here for a little critical thinking. So, previous injuries, the suspensory ligament strain and the Hark arthritis, the current complaints, everything under these chief complaints and the behavioral signs indicates that this horse is very sore in its hind end. Would you agree? Let's dissect how we think about it. When you read this, can you picture a horse if both hocks on both hinds are sore with arthritis, and then you have a right forelimb suspensory chain? So the suspensory is in the front, the hock arthritis is in the back. Which leg do you think is taking the bulk of the load?
The left front.
The left front. So that would be the very first area from a bodywork perspective that I would be like, I want to put my hands on that and see how tight that is. If that is taking the brunt of everything, that's probably an area that we need to do a lot of work on while we are supporting the rest. But we have to take that excessive strain off the front and give that some relief, or you're going to end up with a tear on that front side too, that left front as well.
Would you think that the right front got injured because the horse is not working well behind, so it's dumping all its weight on its forehand, and the right
it
front
probably was the right front originally that was taking the bulk of the load.
Okay.
And that's an assumption. So don't know that for fact. That's purely assumptive. But probably that, and this is how I want you guys to start thinking. It's going to help you so much when you go out and start working and practicing with clients. So range of motion, I'm going to just answer this. So we are going to look at head to neck. That's one. And then we want to look neck to shoulders and forelimbs, right? There's two. And then we want to look at the spine, right? And so when we're doing the spine, we're looking, can we laterally flex the spine both sides, and can we elevate and drop the spine with pressure? So we're looking for flexion and extension through the spine, as well as lateral mobility. Okay, and then on the pelvis, range of motion, what are we assessing?
Can the horse
Rotation.
tuck
Yeah.
and tilt?
Yep. I have videos for you guys that I'm uploading, but also you can like hook your fingers on the point of the hip and pull down gently and see which side moves and which side doesn't, because one will and one won't in a case like this, or both won't. If they both are moving and they move excessively easy, that would be a red flag for me as well. I would start to go, why? Because that would mean that while there's arthritis and dysfunction in the hocks, the horse is not stabilizing further up. It should be tighter from a compensatory standpoint. Doesn't have to be rigid, but there should be more tension there. It should not be super easy. And then we can do limb extensions. So when you're picking up one of the limbs and you're stretching it forward behind and then rotating it around in a circle to make sure there's no strange dysfunction going on. So what types of dysfunctions could explain, and we're theorizing here. So this is where we start to borderline on like, are we diagnosing or not? We're not diagnosing. We are thinking through what could be the cause of all of this stuff going on.
Pelvic dysfunction.
So pelvic dysfunction. I cannot type tonight. Okay, pelvic dysfunction, any specifics you would think about through that?
It would be hard because I would want to see the
Wanna put your
rotation.
hand-
But yeah.
Yeah. So, but what are some pelvic dysfunctions that we could think about? And these can be subclinical. It doesn't have to be like diagnostic level. What's one thing that gets injected all the time in the pelvis because the vets say, "Oh, the pelvis isn't moving well.
Yes.
Let's inject the
The SI joint,
SI joint."
SI joint.
Okay.
Like, could it potentially be like a roached back, or like something with their like that?
So could they have like a lumbar, like, I mean, they could be even kissing spine back in
Right.
the lumbar region. How about the superficial, the ligament? My brain is, I'm so sorry, I'm so fried. I can't think of my anatomy terms. Not the nuchal ligament where it turns into the why is this escaping me? Totally escaping me. The superficial, cannot think of the word. The ligament along the top of the back. My brain has just like totally dumped that language right out.
Nuchal ligament?
Well, it's along it, so it's not in the neck, and at the wither at T1, it changes from the nuchal ligament to the superficial. Shit, I'm so sorry. I gotta know now. Give me just a second. I'm gonna find it.
Is it the super spinous?
Yes, thank you. I'm like, oh, what is it? It's like the supraspinous ligament. That's the ligament that supports. And can you guys still see my screen? We're back to that. Okay. So that's the ligament that goes along the top line, and that is what is involved when they do when they snip the ligament, which I don't remember the term. I never can remember the term, the ectomy, whatever, when they cut the ligament for a kissing spine, but there can be damage to that ligament in the lumbar, and that is not uncommon. Things that can cause that to just kind of run through. Saddles that are too far back where the rider is putting the weight on the lumbar region. The horses do not have the support structure in the lumbar that they do in the thoracic to support a rider's weight or the weight of a saddle, etc. For with excessive weight on top of it. It has to be very, very distributed. So there's that. And often pelvic dysfunction comes from a hip dysfunction or something in the feet, if it's not coming from in the head. So some of their dysfunctions, I'm going to point this out because this horse is sensitive to grooming. There could be nutritional, if I can spell. So magnesium calms the nervous system down, like in the nerves in the fascia. The skin is covered in fascia, like right underneath there. So horses that are kind of muscle fascinating or skin twitching or really aggravated with grooming, sometimes just adding a good magnesium malate or magnesium citrate. I prefer the magnesium malate, but that can calm that down significantly. But if you see horses that are very resistant to grooming, sometimes it's a nutritional deficiency.
Can you do too much magnesium?
Yes.
Okay, and it causes almost the opposite effect.
No, you will have diarrhea and colic.
Okay.
um, the first signs of too much magnesium are very loose stools or diarrhea.
Okay.
And then what comes with that? Stomach aches. So you can do too much magnesium. Usually if you're going slow with it, the horse will tell you the threshold when you're getting into kind of the danger zone of too much, and you can back it down from that. Magnesium is used up pretty quickly. It metabolizes very fast. So if you just cut it out for a day or two and then start over, you'll be fine in the majority of cases. So stiffness, we've already talked, right? This horse has an old suspensory tear. It has the soreness in the hocks. I would be really, really curious as to what the feet look like right before a trim. That's where I want to see how are those shoes wearing? How are they really wearing down? So we could ask about and if there's very special farrier work going on here, why, and are they doing it with radiographs, or are they just doing it because they can tell, or are they just doing a standard, every horse's foot is going to look exactly the same, if you understand what I mean by that. Like, some farriers go out and they want every horse's foot to look super pretty, but that's not necessarily the best for the horse. So from the behavioral signs, and let's recap on those really quick. We'll go back up to what their behavioral signs were. So the ears being pinned when they tack up, the tail switching over the lumbar region during grooming, and a reduced appetite. What does that tell you when we start to come back down and look at what we're assessing in possible dysfunctions? Anything else that you guys would pull away from that, maybe, or start to question?
Thoracic sling dysfunction.
Okay. So I'm going to go back up. The horse is, where's my behavioral? The horse is pinning its ears while it's being tacked up. We could add a question here and solve our problem. Saddling. So when is the horse pinning its ears? Is it while they're putting the saddle on, or is it when they're bridling? That can tell us a lot. One horse recently for me, the owner is frankly kind of a lazy groomer, and she doesn't often brush her horse's face or forelock. She kind of just does a really fast job to just get done. And her horse started throwing his head when she would put the bridle on. And when we dug into it, horse had sliced right in the middle of his fetlock. He had a cut. Of course, he doesn't want anything being pulled over his head. It was pulling on that. So nothing else going on in the body. He just had an acute injury there. So potential dysfunctions. We could look if there's ear pinning. The big question is, when is the ear pinning happening? Because that could be a cranial or upper cervical.
I was just going to ask too about the TMJ with the unwillingness to eat.
Yep. So is there TMJ stuff going on?
Is that new?
What?
Oh, I'm sorry. I did not realize I am not muted.
That's okay, Nicole.
Sorry.
Is there anything else that you, and when you say TMJ, we always, so everybody has a TMJ. When people are like, oh, I have TMJ, well, no shit, we all do. You have TMJ dysfunction. So it's TMJD is the term, the abbreviation. Anything else that we could possibly, before we put our hands on him, start to make some educated guesses about? I think we're being pretty thorough here. Pretty good? You guys good? Okay, so let's move on. So this is where it starts to get tricky because we don't have a horse directly in front of us. However, I can tell you what I found, but I'm giving you a hypothetical. These are the easy ones. So what I'd like to do is hypothetically start to think through of where else you might be finding, like you're working on this horse. You have all of this history. Where else do you think you might find some things that you need to pay close attention to?
The gluteal muscle.
Yeah, you want to check those gluteal muscles.
The TFL.
Yep. And Diane just hopped off, but I went and worked on her horse today and we walked through it, and she's recently had a problem, and the vet came out and kept telling her that the vet literally said there's nothing wrong with your horse. Her horse has fibrotic osteopathy now and cannot flex through the hock or the stifle on the left leg. And something happened after we had several feet of snow that the right hind, she started paddling the right hind out and circumducting. And the vet said, oh, your horse is fine. It's just a little minor strain. You can go do whatever you want to do. When she palpated, I had her palpate the TFL on the right hind today, which is the unaffected side. Was the unaffected side. There's a spot of fibrotic myopathy in that hind now, right between the semimembranosus and the semitendinosus. So that fibrotic myopathy, from whatever she did, is already starting to change texture. So what else do you think? Where else might we look here? You guys have said it several times, so I'm going to make you think on it.
I would even check through the shoulders and the thoracic sling to see if that's overcompensating. And the hind end isn't, because the hind end isn't working as well.
Yep.
Would you also look at the intercostal area?
Absolutely, because the horse doesn't want to eat. So what kind of restrictions is this pain starting to come up and cause, like, just, I mean, how we've all had tension, and when we're tense or we're cold, what happens? We tighten up, right? So if there's been pain and dysfunction and discomfort, then likely the rib cage, because when we don't feel well and we have an injury, do you deep breathe or do you shallow breathe?
Shallow.
We shallow breathe. Oh, Diane, you came back. Awesome. I was just telling them a little bit about Naomi this morning.
Well, actually, I'm going to have to go in a second, but how
Okay.
about when you talk about the intercostals and all that, how about fascia
Yeah, you're going to be working through all of that through the intercostals.
causing that tightness and tension?
So here's the next question on the hypothetical. If the horse is not pushing from behind and we're checking through the shoulders and the thoracic sling, we will find stuff there. Like this horse has stuff there. Going further up a little bit more, what else? Where's the balance come from? Do you guys remember? At the pole. So without a doubt, even if it is not the direct cause, that hyoid apparatus and everything in the junction of the pole, where the neck and the cranial and cervical meet will probably have some resistance. So we're going to look at that cranial cervical junctions, right? Anything else? I mean, we're probably finding, realistically on this horse, we are probably finding pretty significant myofascial restrictions, probably some pretty significant resistance. I would imagine that this horse is fairly slab-sided in the shoulders. And I'm saying I imagine, I know it's true. I've seen this horse. The horse is slab-sided in both shoulders. And however, in the forelimbs, do you guys remember your muscles? Do you remember the main muscle in the front of the forelimb? Kind of the equivalent to the gaskin in the back. Anybody? There's several muscles. So if you don't remember, that's okay. But on the left forelimb of this horse, that muscle is overdeveloped and huge in comparison to the right. But that right suspensory injury was 2 years ago. So we shouldn't have that much of a disparity in symmetry. Neck flexion around C3 and C4, there's not great mobility there. There's a lot of restriction. And the horse has overdeveloped brachius cephalicus. The lower neck muscles are overdeveloped because the horse does this, pulls his neck back to compensate because he can't put, so he's pulling with the front and trying to counterbalance it by pulling the head back so he doesn't fall on his face. This helpful for you guys so far, what we're doing tonight? Good.
Okay.
Okay, so when we come up with our plan, within our scope of practice, and we're doing therapeutic massage, what your modality that you guys are learning in this course is therapeutic massage. So that would be the modality that you use, but what techniques would you use, and would you possibly recommend other therapies? So I'm going to put the therapeutic massage in there.
Continue with chiropractic.
Okay. How do you feel about the frequency?
Probably be a little more often.
Where am I missing? R. That word, gosh, I cannot type today.
I would say craniosacral and cupping for some of the deeper tissue in the hind. And PEMF.
So this hind end stuff, we could consider some cupping and craniosacral there. Craniosacral in the whole horse. What was the other thing you mentioned?
PEMF.
Yep, so you could do PMF. What else could we do for this horse? Do you think that one session would be enough?
I feel like you would be spending so much time figuring out and unraveling things.
Yeah.
And just getting to know the horse, because I have just a feeling that this horse might be a little hesitant to some things.
Yes. Daryl, what were you about to say? You were going to add to that?
I just said no. I don't think one session is going to do anything.
Okay.
I mean, it's on the right track, but no, I don't think you're going to get noticeable results from one session.
Yeah, I would agree on that. Best guess, how many would you start with? if you're to recommend to your client. Anybody else? Candace says 4.
Yeah, I would try, I guess I would just try to be like, can we do once a week for a month and just reassess and see how that goes?
That is exactly what I would say. And I would explain that we are peeling an onion, and I would set that expectation with my client that this might look worse before it gets better, but we're drawing out to try to get to the root cause. We know what some of the root causes already are. However, we don't know what the horse has adapted in regards to that. And we have to kind of figure out where the sweet spot is so we don't take away too much compensation because of the arthritis. But arthritis, horses tend to work out of that unless it's super severe. So you might make some recommendations in terms of longer warm-ups at the walk. I'm going to just put some of this in here. So the body work plan would be some exercise, and we're not telling them how to ride their horse. Do you understand the difference? We're recommending rehabilitative exercises, not how to ride the horse. They can do this stuff in hand, under saddle, talk to their trainer.
Would this be like a time where you could like talk about like warming up in the synovial fluid in the joints and stuff to kind of give them that educational piece of it?
Yes, absolutely. Like, so a good rule of thumb is, and horses under 10, you want to do 2 minutes of warm up for every year of their age. That's kind of a rule of thumb. A horse over 10, you do 1 minute of warm up for every age they are, unless they have arthritic, and then 2 minutes of warm up at the walk for every year that they are old. It's an easy way for people to remember timing. Like, your horse is 17, we have a long warm up. Your horse is 4, you have 8 minutes. And that's usually enough because of their activity. You can do longer or more based on their health and etc. But so you could do some, let's say some, so you do some structured warm up and cool down recommendations. What else might we recommend here? We'd said something else and I forgot it already. Sorry about that. So Daryl, I would love your opinion on this, but when I have horses and clients that are having lumbar pain and discomfort, and she has stated that this horse is struggling in the trot and gets sore after harder work. There's imbalances going on. We've seen that from what the farrier had stated. And with the bulk of the problems being in the pelvis and lumbar regions, I would probably recommend to this client that after they have done their walk work, that they do a couple of canter, they canter the horse both directions before they begin the trot. And I would make that recommendation to get the rotation in the pelvis so we don't just have heavy up down motion.
Yeah, I honestly tell most people to canter first because, well, also the canter has an uphill, upbeat and a downbeat event, right? Like, yes, it's 3 beats, but the horse is going uphill and it's going downhill. Where the trot, it's like pretty static.
Yes, exactly. And you just explained that much better than I did. Thank you.
I just told everybody that this weekend. But right, like it's one of those things. I have 2 clients right now with horses that are really sore in their lumbar, and people are trying to say it's something, and I don't think it's what they think it is. But the lumbar gets, I personally think the lumbar gets really sore when the horse isn't working properly. And if the horse can't sit and push from behind, they're pulling from their shoulder, they're tight in their back, their pelvis is stuck out behind them, and they're just shoving themselves on their forehand. And
they are, and those
they can't get out of their own way.
Yeah, and you probably see that they have overdeveloped hamstring muscles. and underdeveloped glutes, and they tend to park out behind in one or both hinds at rest.
Yes.
Yeah, so I mean, lumbar discomfort, horses are very obvious when that's sore. They're very, very obvious. Um, so, let's say I like this word, reframing. So meaning that you might have to modify exercises. Um, and those might be in hand. Would you recommend doing any kind of like backing exercises with this horse, like in hand backing up or down hills, or just on a, like, what would you recommend for that? Would you recommend anything?
I think what is it called? The Equiband that you ride in can be really
Yes.
helpful. I think you have to be careful not to use it for too long because I think it can make horses really sore. But if you like warm up with it and then take it off, I think that can be super helpful.
And you can also use them fairly loose so that it's more proprioceptive and not just resistance. So that's an option too. I love that. I love the Equibands. I think they're excellent when used correctly. Would you recommend any other possible exercises here?
I know it's limited on people's availability, but aqua treads can be really helpful for stuff like that.
Yep.
Or water complexes if you have those at an eventing facility.
All right, brag about it. Why don't you,
Well,
Brandon?
it's expensive. They might have a water complex.
Hey, my water complex is 2 strides across, so it's not going to be very helpful.
Would you swim this horse?
No,
Why not?
because I think it would be too hard on his back.
Okay. So, when you talk about aqua treads versus swimming, do you know that you swim the legs and you use an aqua tread for the back? So the aqua tread with arthritis and a suspensory tear, when this horse is sore through the pelvis, the aqua tread would be way more beneficial than swimming. Swimming would put excessive strain on the spine. But swimming is great for leg rehab. It's not so great. Aqua treads are not so great for suspensory tear rehab. Depending on the vet that you talk to. So with our plan, do you guys feel pretty comfortable that this would be a good way to start off and build upon? I think I forgot to put the frequency of what do you guys think so far? We have a pretty solid idea of what we want to do here, right? Anybody have any questions or feel unsure about what we've put together? No? Good. Okay, so how can we effectively communicate all of this to the farrier, the rider, the vet? And we probably won't really type this, but we'll
I mean,
talk about it.
Good notes that you can share with them.
Yeah, so okay. What else?
If you already have a relationship with the vet or the farrier or the chiropractic, offering your number so that they could communicate to you or open those lines of communication.
What do we need in order to do that from the client?
A consent form.
Yep. Because I will tell you, there are clients who will be like, I don't want you talking to my veterinarian. They're so afraid that they will lose them if somebody talks to them. So we have to leave it to them to have that conversation. And here's what your client's going to do. You're going to say, I found some restriction in the lumbar. The client's going to go to their vet and said, my body worker told me that my horse has a lumbar dysfunction and they're going to diagnose on your rehab. And so your notes are your CYA. Because your client is going to relay everything you tell them in diagnostic language. So your notes are important to protect you from that. If you are having that conversation with the farrier or the vet, you can avoid that somewhat. But yeah. And so this is a trick question. What diagnostic tools or treatments might you recommend? As Candace's eyes just got huge, like, we don't do that. Okay, we cannot recommend diagnostics. We can recommend and refer them back to the vet with our notes on what we suspect. It is entirely up to the vet to determine diagnostic tools and treatments from that point. We can only recommend treatment within our scope of practice. And that might mean that you think that the horse would benefit from PMF therapy, but that is, you can recommend, let's type this in here. Oops. So very carefully. So we can only recommend, legally, we can only recommend complementary therapies, meaning we can recommend PMF, we can recommend cryotherapy if we think that it's important. But I will tell you, be familiar with what those therapies do before you recommend them. Is there anything else you guys would add there? And I know we're coming up on 2 hours of doing this, so I'll try to get you guys out of here ASAP. No. So educating the client. We started to talk about this already. And we won't type a ton in here, but let's talk about how we would explain this to the client. How would we educate them? And don't feel like you have to have it all right. The whole point of this is so that we're learning. So let's just pop off our ideas. By the way, I'm thoroughly enjoying some of the smirks from people on the camera tonight. This is cute. You guys have your little things going on behind you that are making big smiles come across people's faces. I like it.
Well, mine is my dog that needs to go outside because he's freaking raunchy.
That's nice.
It's terrible. He's never typically like this.
Stinky butt. So what do you think we would say here? Or would you like for me to?
I mean, you're
talk
saying
about
basically how that he can maybe feel a little bit worse after the body work before it'll get better. And I don't know, like typically most people have probably had at least one massage in their life or something similar, so you can relate it back to that. because that's how they
Okay.
get like the best.
I think too,
So,
the time to reiterate the onion thing and that you're peeling layers off, and also to reassure them that some other things might pop up as a result and that it's a process.
so the way that I explain this to a client is I will say, let me explain something to you. If you have a headache and you kind of have a headache all the time, you notice it until you stub your toe. And then you can't think about your headache anymore. You're only going to think about that stub toe. But let's say that we get rid of your headache and then you realize that your mid back hurts. Your mid back probably always hurt because it was connected. It just wasn't loud enough for you to notice because your brain can only process certain pain areas at a time. It is very difficult for the body to go, my head hurts, my back hurts, my leg hurts. Something is going to be like, I'm the one you have to pay attention to the most. And it's exhausting. If you've ever had multiple areas of your body hurt simultaneously, it's very tiring. It's taxing on the body. And so prepare your client that as the horse begins to feel better, their behavior may become a little bit more exuberant after a while, or they may become calmer as their pain is relieved. So behavioral expectations. Anything else that we might want to like explain to them?
I mean, just for them to note any changes that they might see as you do the sessions, because like they're basically going to be your regular eyes there.
Yep, that was exactly where I was going to go. Anything else? There's not much more I would probably add, but if anybody has another suggestion that I'm not thinking of, shout it out. So, and then we come back to that great question of what changes to his management plan benefit him.
I think that's hard because we don't have the answers to most of those questions.
I was hoping somebody was going to say that. I was literally hoping like, well, we don't really understand his whole management plan, so we can't accurately answer this question. So this would be, we need more info, right? Yep. Anything else? We really can't add anything else to that because we just don't know yet. So, ethics and our scope of practice, like considering all of this, how would you navigate? Like, if the pain in the pelvis is linked to arthritis, how would you go about talking to your client about that? And let me share with you, arthritis is a symptom of overuse or dysfunction and compensation. So if there's arthritis, we have overuse or there's something else that's causing it somewhere else. And this is the part where most people get real quiet because it's scope of practice. We don't want to like, we're intimidated by the vets and things like that.
I mean, wouldn't you basically just say like, I'm feeling this, this, and this in this area, and I would recommend going to your vet to see if there's further underlying issues causing it?
Exactly. That's all you can say, right? That's all we can really say is, you know, with the other findings.
And if you might think it's overuse, then you could talk to them, tell them to talk to their trainer, right? Like maybe this horse shouldn't jump every other day or whatever.
Yep.
I have a question for you on this one, Chris. So the farrier, because the farrier I think obviously needs to be talked to as well, because he's saying that like shoes are very uneven, but the hooves are balanced. So how would you approach that one?
With kid gloves, because farriers they just do not like to be told. So here's how I would approach it and how I have approached things like this. And I did this on this horse to share with you. I basically said, hey, out of curiosity, would you mind explaining to me? You're saying that there's no imbalance, but yet we have hoof wear. We have uneven hoof wear, and we're seeing all of this coming up within the body. Is there anything in what you're doing that we can tweak to help further support the soft tissue structures of the body to minimize everything else that's going on? I would not insult them. I would just be like, what do you recommend? And can you explain to me what you mean here? Let them educate you, because they love to do that. And so let them educate you a little bit and then say, okay, so what could we tweak to ease the strain on the hocks? Do you see what I mean? Like we're asking the question, but not telling them how to do their job. Because I can tell you as a body worker, you won't want some lay person to come in and tell you how to do your job. And it happens. So here, I'm going to give you a scenario because this is one, and Diane and I talked about it. Hopefully she won't mind that I'm going to share it today. Let me type this before I forget. Oh, hoof. I don't care. Okay. So what happened, I went to work on her horse today. We're going to use her as a case study. So we've already talked about that. But while I was getting started, I asked her a ton of these questions. And here is what she said. She said, oh, I'm not going to tell you. I want to see if you find it. And I turned right around. I kind of whipped around on her a little bit. And I said, I want you to think about what you just said, because you're going to be asked that question. How are you going to handle it? Candace, you've been asked that, I'm sure. Right? So when somebody comes, you have been asked that?
Yeah.
Or they're like, oh, I'm not going to tell you. You find it and I'll see if you're right.
Or they're a lot of times they're so anticipating losing business if they make you look like like it's just like an icky situation. Like
it can be.
Yeah.
So I'll tell you how I handle it, because every single person in this class is going to get that. You're going to be tested. So here's what I say. And if I could spell things correctly, I'm finding all I just spell it right. Just didn't put a period at the end. Here's what I say when clients ask me that. I'm like, I really, truly appreciate that you want to test me right now, but you're paying me to come out here to work on your horse, to provide your horse the most comfort that I can. Withholding information, if you want to test me, that's all fine, but I just want to explain to you that you're literally paying to test my skills. If you don't trust what I'm doing, it's better if I just walk away. But I need your information so that I can best provide the best quality care for your horse. If you want to know if I can feel or find something, we are happy to go out and play around with that. But right now, you're paying for my time to give you my best work. The more information I have, the better I can help with your horse's care. The more you withhold from me, yeah, I might miss something, because look at the size of their body. There's no way I can address everything in the body in 1 hour to 2 hours. It's not possible. And it's a kind way, but it's also a big wake up. And frankly, if they never call me again after that, they never call me again. Because if they're going to just test me, they should save their money. If they don't trust me to be there, they should just save their dollars. Any concerns about how I approach that? And I'm going to stop share on this. No. It's not, we can be direct with our clients and we can still respond with kindness. We don't have to be nasty about it. But I am direct. I'm like, if you feel you need to test me, why? Why'd you call me? Like, if you want to try my work, then let's go through it the way that is the most appropriate and beneficial for your horse. But if you just want to test me, why'd you call me? You know, it's one thing to give me a try, but let me do my job to the best of my ability. Don't just try to come out and go, let me see if you can figure it out. And that's the attitude you get. Let me see if you can figure it out. I have a client messaging me repeatedly at the moment. I worked on her horse yesterday. I did cryo. The horse was foundering on its front feet. I did cryo on it 3 weeks ago. The vet was like, oh, it's too late to do cryo. It's way too late. Doesn't benefit. Save your money. The cryo from one session helped this horse want to go outside and walk down the aisle and move much more easily. So I gave them the whole protocol on what to do in between cryotherapy sessions. The farrier went out and put the biggest contraptions I've ever seen on a horse's foot, both fronts. They did the shoeing with radiographs, the glue on shoes. Now the horse won't walk at all. And the farrier said, no more cryo. And the vet said, I agree. So yesterday I went out to work on the horse again. And I said, your farrier and your vet both said no to the cryo. And she said, they don't think that they think it's contraindicated and that it's just a waste of my money. I said, I think your horse is foundering in its hind feet and you need to have that back out. That went out today. The shoes have shifted. The right front now has significantly more rotation than it did before they put the shoes on, and the horse is foundering in the hind feet. It was kind of one of those circumstances where conservative therapy was working and they decided to get extremely aggressive, and now it's much worse. So you're going to have those circumstances too. It's gratifying that I was right and heartbreaking that the horse is suffering. So what good did that do me? Not a whole lot. But I ended up having a very good conversation with the vet. I was able to demonstrate the cryotherapy for the vet. They had no idea. They thought that they were just using ice water and rubbing alcohol, which is not what they were doing. That's what they were doing in between sessions. And it was drawing out so much inflammation that the horse wanted to walk. The horse won't walk at all now. Like at all. So you're going to get faced with things where even you know it in your gut, you know it from every clinical sign that you're looking at and subclinical sign you're looking at, and they will still not believe it. They'll still go another route. And we don't, not my pasture, not my problem kind of thing. We're involved and we care. We don't have nearly the boundaries that vets are good at. We get too involved. And it hurts when we see them like that. But you're going to face it. And so everything that I was offering and recommending was being shut down by other members of the care team. And I got outvoted. That's going to happen to you too, even if you know it all. I'll be up in a few minutes. We're almost done, babe. Coming up. Sorry, I'm getting the. Do you guys have any questions for tonight? No? I hope that this was helpful. I hope it got some gears turning and, you know, the thought process of how to think through it, especially as you're starting, a lot of you are starting to practice the cranial, cervical, and thoracic massages. It's okay to ask a ton of questions. And I mean, your clients will forget important information. I think I was telling you guys that that they were like, oh, you think it could have been from the colic 3 weeks ago, after I had asked of all of the things that were going wrong with this poor horse and they forgot that he colicked. They don't remember. And as horse owners, it's very hard for us with our own horses and for your clients to see the forest through the trees. They see what's right in front of them. They will miss the subtle signs, or they will hyper analyze and then miss other parts of the big picture. So don't be afraid to be that advocate and for the horse and speak up to them. But if you guys have no more questions, I'm going to stop our recording.